This is the Robert Wood Johnson Health Policy Podcast Series, the interview series with the nation's leading experts in health policy. Our guest today is Dr. Craig Garthwaite of the Kellogg School of Medicine at Northwestern University. He's been studying health insurance and job supply, and what he found in a unique situation in Tennessee may say something about the potential labor market impact of the Affordable Care Act. We asked him to tell us more about his work and what it means.
In many ways, the United States is unique in that we tie the provision of health insurance and employment very closely. And economists have long wondered sort of what kind of distortions this creates for the labor market. Why this is becoming very important now is that the Affordable Care Act, sort of America's Health Reform Act, often called Obamacare, is going to fundamentally change that relationship. For the first time, we're going to have a real viable non-employer option for health insurance. And we wanted to get a sense of what would be the labor supply effects of that. Now, the hard thing is that we've never done anything exactly like the Affordable Care Act before in the history of the United States. We've had some small state initiatives. A lot of people looked at the state of Massachusetts. We wanted to expand the body of knowledge, and so we bring in rather unstudied reform in Tennessee, the Tennessee State Public Health Insurance Program, TennCare. This was an expansion of TennCare that actually looked quite a bit like the ACA. And then in 2005, they were forced to roll that back. And so we look at this disenrollment as maybe the mirror image of what would happen under the Affordable Care Act.
Okay, and so what were the key findings?
The key findings that we found that when you took this public health insurance away from people, about half of them swiftly moved into the labor market. Right? And this is an idea that what they're doing is they're looking for health insurance. And when you can't get public health insurance in the United States, really your only option left from the majority of people is to get it from your employer. And so we see people able to move quickly into the labor market, and we see increases in private health insurance coverage.
So how do we apply what you found in this kind of mirror image effect to the Affordable Care Act?
So we look at a sample of individuals who are very similar to people on TennCare. So you earn less than 200% of the poverty line, you have employer-provided insurance, and you're not eligible for public health insurance. And we find there's anywhere from 1 to 1.5 million people in the United States like that. And if you apply our estimate to that population, it suggests that anywhere from 500,000 to 900,000 people are going to leave the labor force as a result of the Affordable Care Act. And the important thing that we want to think about is that this is about sort of people's individual choices. It's not about jobs being taken away. But this is all about labor supply. The idea being that you no longer have to work to get access to health insurance. The provision of public health insurance is going to mean that people aren't going to want to work as much, or not as many people are going to want to work in the labor force. And it's not clear whether that's a good or a bad thing. Right? Right now we have a very inefficient provision of health insurance. You have to work to get access to health insurance. And it's really the only good in the United States that's like that, where regardless of the amount of money you have, to get a fair price, you have to work. And so we're going to fix that, and that might result in fewer people working, and we might have to pay more for public health insurance. We've sort of decided that's what we want to do with the Affordable Care Act, and we're just sort of documenting the magnitude of the effect.
So we're nearly about out of time.
Okay.
Do you have any closing remarks for our listeners?
I just think that it's important to think about sort of the intrinsic role of health insurance in the labor market, and that's going to be an area that I think all scholars need to spend more time thinking about in the time going forward.
Okay. Well, thank you so much, Dr. Garthwaite, for both your time and your perspective.
Thank you.